Good morning, everyone. My name is Olivia McDonald, and welcome to an episode of Coffee Break with CARD, La Hora del Cafecito's sister show. Coffee Break with CARD is a program dedicated to all those in our community who are living with autism, to their family members, and to all those who support them. So come in, join us at our virtual table, and leave us a comment down below. Let us know if you're having a cup of coffee, tea, water, whatever you're drinking to stay hydrated. So in today's program, we have the pleasure of interviewing Dr. David Berger of Wholistic Pediatrics and Family Care, who is going to be talking with us about the link between preconception health and autism, as well as advice on what both parents can do to support a healthy pregnancy and developing baby. So please join us. We have lots to talk about. Let me go ahead by start off by introducing you to our coffee break hosts for today. So as I mentioned already, my name's Olivia. I'm a CARD consultant assigned to the early age team and a certified public health professional. I'm also the mother of a very active toddler who just turned 21 months and have a younger brother diagnosed with autism. So something all of our regular viewers may notice, you can see that Lourdes, Yasmin, and Maggie are not able to join us this morning, but I have amazing guest co-hosts this morning that I'm very excited to introduce. So Ellie Weber is our Assistant Director of Education Services. In addition to supervising the CARD-USF consultants and providing direct assistance to families, she collaborates with school district representatives from our 14 counties and leads our efforts in providing technical assistance and trainings to educators. Welcome, Ellie. Good morning. Oh, you can unmute if you want, if you want to say hello.
Hello. Yeah, sorry. I thought you were unmuting us, but you've given us the controls back. So
yes,
that's
you can do it. Good morning. Denise Barnes is a CARD consultant working primarily with our young and older adults and their families, as well as leading many of our safety and law enforcement training initiatives. She also splits her time as the Florida Center for Inclusive Communities Employment Coordinator. Welcome, Denise.
Good morning, everyone. Thank you for having me.
Thank you for joining us. Thank you very much to both of you for being here this morning. And I promise Facebook Lives are not that scary. So before we get started, we want to review the rules that we want to adhere to during this episode to ensure a safe environment for all of us. So please remember to keep an open mind, a positive attitude, and to use respectful language. So let me take a moment just to see if there's anyone in our audience we want to say good morning to. Oh, we want to say good morning to Angel. Hello. As well as Mark and Philomena, my mom, our number one fan. I like to joke. Good morning. So as I mentioned earlier, for those of you who are joining us a little bit later, in today's program, we have the pleasure of interviewing Dr. David Berger of Wholistic Pediatrics and Family Care, who is going to be talking with us about the link between preconception health and autism, as well as advice on what both parents can do to support a healthy pregnancy and developing baby. So let's get started. Good morning, Dr. Berger.
Good morning.
Hello, hi, how you doing today?
Hello. Well, we actually just want to introduce, after introducing you, can you tell us a little bit about yourself?
Absolutely, absolutely. So I'm a board certified pediatrician. I did my residency at Tampa General Hospital from 94 to 1997. I've been in private practice. This is now 25 years of being a pediatrician, which is a bit of a mind-blowing number for me. And I started working with special children at my clinic at 17 Davis down in Tampa General. But as I started learning more about natural health and different alternative functional medicine approaches, families with children with autism started approaching me. And that's really how the early ages started. It was just kind of a word of mouth. Hey, you help my kid. Can you, or my friend's kid, can you help something? But I'm currently on faculty at USF in the College of Nursing. I'm involved in helping to train nurse practitioner students. I do also have a medical cannabis cannabis company called Wholistic Relief, where I do focus on both on more children's health and senior health. We do a lot of education, taking very conservative approaches, using many different types of cannabinoids and only using THC as a last effort if nothing else is working. I also have a health education company called Dr. David MD, where I have a YouTube channel under that name. And I just started with Instagram, and I actually just started doing TikTok, not for the dancing, but paging Dr. David is my thing where I'm all about health education and choices. And a lot of what I really do and why I like to doing shows like this is to be able to share my knowledge with people, because I realize on a one-to-one basis, you can only get so far with the patient. So I really make a point of being available to media and to groups such as yours and anybody who wants to talk to me, really, because I love teaching and I want to share what I know, because it seems to be making a difference in a lot of people's lives.
That's awesome. And did you want to touch on a little bit about the P2I protocol?
Yes. So P2I, which stands for preconception to infancy. So going back to about the year 2000, when we started showing significant improvements with people with autism through dietary modifications, looking for nutritional deficiencies, focusing on the gut microbiome, are the good guys there, are any bad guys there, other toxins, looking at some of the genetics, especially related to nutrition. And as these kids were getting better, we had a series of families who said, hey, we didn't know if we would have another child. We've been so challenged with our first child, but our child's doing better. We're ready to have another one, but is there anything we could do to try to prevent that from happening? Can we do these same types of tests? Can I do the same types of treatments that you've done to your kid? And after about 30 seconds of thinking, well, I'm a pediatrician, so should I be seeing adults? I came to the realization, is there anything different between an 18-year-old woman and a 34-year-old woman? And there's not. And the weird thing is that grandparents started asking me if I would be their doctor, of which that became kind of interesting. And so I made an agreement with them that as long as I'm okay to pull out the pediatric card saying, I don't know that one, but let's figure it out together. But I'll never overextend what I think I know to be that. So out of that and my work with this, and I've been working with children with autism at that point for a while. And a group called the Forum out of Portland had put together a think tank with myself, one of the heads of autism at Harvard, and also one of the head. He's a biochemist / measure of things. And what I mean by that is he, for NASA and for all types of things, he's figured out some very advanced mass spectrometer types of testing in order to look for micro amounts of things, mercury or lead or other types of toxins in the body. And so the three of us put this presentation on. It went over very well. I was then asked to actually do a full 2-day seminar to all the physicians and pediatricians and other people in Portland as a result of that. And also at that time, I published a paper in Autism Science Digest called about preconception to infancy and ways and strategies to reduce autism. And we do have that information available. I think that you guys can share that link, and it's also on my website. And that paper took off. And I didn't even realize at the time, but it went international, went through the CDC, through the FDA. We then were contacted by the government in China, and they actually started building P2I clinics over there. It's now becoming standard of care within the international OB communities have been looking at this. So I kind of started off with this idea of an observation, and next thing I know, it kind of is taken off. So it's kind of cool. Yeah.
Very cool. So kind of related to that, can you please explain for us why it is important for those with a family history of autism to address their preconception health?
Certainly. So, I have been doing this approach now for, it's probably been 20 years almost. We know that in America that there's about 1 in 55, give or take, in terms of children who are being diagnosed with autism. And we also know that it's about 1 in 7 if there's a first child already when it comes to a sibling. So since we started doing this, to the best of my knowledge, we have not had any second children go on to develop autism. Some ADD, but not to have the diagnosis of autism. But furthermore, in terms of our overall numbers, so when I what I refer to as babies born to us. To me, that's babies who either start with us preconception, so parents taking the approach even before they conceive to have all their nutrition and everything in play, or during pregnancy, or during the neonatal period. That's what I call being born to me. And we have not seen an autism rate of about 1 in 500, as opposed to the 1 in 50 or so. So I would love for someone to come take my notes and figure out what, and publish all this stuff, because as a a single provider with a small practice, that's, you need millions of dollars to do that kind of thing. But it does seem as if we've reduced the prevalence of autism by about 90% in our practice. And I know that can be a shocking number to people. And, people who can't possibly wrap their head around that. And I get that. But I also just know what our numbers are. But that's the interesting thing, is that taking this, ear infections are not a rite of passage. The average number of ear infections of our patients is less than 1. And we don't see nearly the numbers of asthma and eczema and like so many of the other types of conditions that kids have. Just our numbers are just so different. But I think it's because this preconception to infancy approach, which we're taking on a lot of people now. And of course, even if they're coming just from a newborn, we're starting right then and there. But, maybe it's God's good graces. I'll take that too. But it does seem as if we're doing something that's making a difference here.
Yeah, and I think the new CDC data that came out really recently from their ADAM sites, it's like 1 in 44.
Yeah.
But I think something for context, and correct me if I'm wrong, but from my understanding is that a lot of the families who come for seeking preconception health, they, based off of, research as far as like what would put them at higher risk of having a child with autism, they have a number of either medical history or family history that would put them at higher risk, and yet still you're seeing those lower numbers.
Yeah, it's amazing. It's been really sweet.
Okay, thank you. Denise?
So, Dr. Berger, what are your recommendations when it comes to preconception health?
Okay, so I spell holistic with a W because we look at the whole picture. Okay, so of course the stress levels of parents, mental health of parents, to the air that they're breathing in, clean air, and what's going into their bodies. But from a purely medical and testing perspective, there are some things that I have found to be very helpful. There are certain nutrients, things like vitamin D, zinc, iron, having those levels optimized. To me, optimized doesn't mean just barely being in range. I aim to have the middle of range on these blood tests. So, for instance, if a vitamin D level should be 30 to 100, I'm looking 50 to 75. I don't want 31. I don't want 99. I do follow-up testing for all of these things to make sure that I'm getting it right. So I'm not just throwing nutrients at people. We're testing levels. We're repeating levels. Another thing that we do is the genes that are associated with how we absorb certain nutrients, how we activate them once they're inside our body, and how we transport them into the cells. All of them happen not just by chance, but by chemical reactions through enzymes. How do enzymes get into our body? Our DNA gets opened up, messenger RNA gets read and made into messenger RNA, and then the messenger RNA is read and it's made into proteins, which are from amino acids, and then enzymes are formed. So if there is a single switch in the DNA code, like let's say, for instance, a typical person would have like, if you remember the double helix of the DNA. So if a person's supposed to have like a genetic that says TAT and that puts down this particular amino acid, if it says CAT instead, it will put down a different amino acid, potentially affecting the function of that enzyme. Sometimes it may speed that enzyme up too much. That actually could happen with serotonin breakdown. So if you speed up the enzyme that breaks down serotonin, you can end up in a low serotonin state. Or your ability to activate folate. So if it turns out that you can't activate folate, there are activated folate forms. If you can't activate B12, there are activated B12 forms. So this is very specific to the individual. Now, the genetic test you never have to repeat because your genes don't change, but this whole system regulates detoxification, inflammation. We now know so much about what hyperinflammation, autoimmunity, all of those things, which does seem to be playing a role in autism. For that matter, that's what We know from COVID, we learned so much about cytokines and inflammation, and it's all part of the same thing. We want to have our immune systems be in a Goldilocks mode. You don't want it too strong, that's hyperinflammation. You don't want it too weak because that makes you more susceptible to getting sick. We want just right. And so that's a lot of what we're doing is we're trying to balance that. Now, another part has to do with the intestinal microbiome, like which I was talking about. How are the levels of the good bacteria? Are there any bad guys growing? So there's tests that I can do, a poop test, believe it or not, if you're looking in the stool, that will tell you what good guys and bad guys are there. There's a urine test that I do because since you can't completely recreate your intestines on a petri dish, the stool test could miss it, but there are certain toxins made by yeast, made by bacteria, not made by humans, that if they show up in your urine, that's another way of identifying it. But also, we're focusing a lot on healthy eating. We know like anti-inflammatory diets, Mediterranean diets, things that lower those cytokines from the negative cytokines from happening, to fermented foods, cultured foods, feeding the gut with the good guys that are supposed to be there, avoiding artificial and highly processed foods. All of those things affect the gut, which affects, there's a term called leaky gut or increased permeability, where things can get into the bloodstream before they're fully digested if there's inflammation in the gut. And so, really making a big look at how that overall goes. That's certainly important. And as I kind of alluded to before, just mental health, the role of stress relative to inflammation, stress just in terms of being able to deal with things. We know that high stress situations can even impact pregnancies. So those are kind of some of the main themes of what I'm looking for. I could talk for 12 hours and not get through everything, but those are kind of the themes.
Yeah, and I just wanted to, before, I know, Ellie, you have the next question, but I did also want to add I shared the link for that article that Dr. Berger mentioned earlier, and there's a whole host of more detailed information about these things, the research behind it, and then some other suggestions as well.
Thank you. Okay, so we've received a number of questions from our families regarding recent research findings in the association between acetylphenamine, autism, and ADHD. And what is your clinical opinion as far as Tylenol use and by those who are planning on conceiving or are currently pregnant?
Right. It's a great question. And for those who don't know, Tylenol is the brand name of acetaminophen. So those are the same thing. I never have been a fan of acetaminophen since I started practicing. One of the things that can happen that acetaminophen can do is lower something called glutathione. Now, I didn't get into much when I was talking about those genes that make things happen nutritionally, but one of the important things that is made by that pathway, so if you have the genetic issue, you may not be able to make it in the first place, is glutathione. Glutathione is the body's most important antioxidant and detoxifier, and really important in controlling inflammation. When you have an infection, you need to keep your inflammation under control. Back to that Goldilocks. Pardon my hiccup. And I apologize. I do have kind of like a hiccupy tick, so sometimes you may see me with a little facial contortion. That's just me. It happens more in the morning. I don't know why, but sorry if you kind of catch me doing that. This happened there. So we need that to be there. So I don't want to knock out glutathione. One of the things that was discovered over 20 years ago, individuals with autism tend to have lower levels of circulating glutathione in the first place. Okay. They've actually showed, and this is actually part of my early work, mothers of children with autism are more likely to have glutathione off, and some of those other B vitamin markers that we're trying to turn on. And that, again, came to where this whole preconception concept is. I prefer using ibuprofen. Ibuprofen goes through the kidneys, does not go through the liver, does not cause a depletion of glutathione. So, of course, there are some people who may have bleeding issues or who may have stomach upsets from it. Glutathione, acetaminophen can actually be given by suppository. You'll see it in the stores. That's one of the things, especially because there's been this acetaminophen shortage happening in the country, we've heard about. And the thing is this, if for a child, if you do it by suppository, when you swallow something, I should say, everything that goes into our mouth and through our stomach and into our intestines first goes to the liver before it goes everywhere else in the body. And in the liver is where the glutathione is mostly being made and where the Tylenol can have its effect. But when something is done by suppository, it goes everywhere in the body. It avoids the liver. That's called the first pass effect, through the first pass through the liver. Things held under our tongue, things done by suppository, don't have that happen. So if you had to use acetaminophen, doing it with a kid, obviously, I guess adults can do it too, but by going by suppository, much less hits the liver all at once and can have a little bit less of an impact on the liver and the glutathione in that way. But that's really what my real challenge is. So, I also recognize that most people use it because their kid has a fever. Fevers are part of our natural immune system and how we fight off infections. There's been a lot of research that shows if you let fever stay, they get better faster. You're letting the immune system doing what it's supposed to do. And there are lots of other things: cool baths, cool drinks, frozen fruit bars, wet towels that you can help someone feel comfortable. So first of all, I don't treat a number for fever. In fact, it's a rapid change in fever that causes a temperature that causes like febrile seizures. You're more likely to jump from a 98 to a 102 for a child to have a febrile seizure than being at 103, 104 all day long. So what I do is I don't treat the number, I treat the misery. Okay, so if a kid's uncomfortable, out of sorts, they can't drink, they can't sleep, yeah, do what you need to do at that point. But just because your kid has a fever, really the research doesn't substantiate using any kind of fever reducers, but pain reducers and suffering, that's it. So I know that there are these lawsuits going around there and stuff like that. Do I think that there's something to this? There could be, because of everything that I just said. I haven't seen the large studies. Obviously, I realize that when lawyers get involved, some things beyond science kind of get involved. But I think that there could be something to this.
Thank you. Is there anything else you would like to share with our audience?
Really just the importance of taking an individualized approach. I realize that as medicine has become more corporatized, how these large corporations where you rarely get to see the same provider again, if you're lucky, maybe if you schedule ahead of time. We have a small practice, so we know our patients and we know our families really well. But obviously the individualness of the genetics, obviously we're not all clones to begin with, but everybody is just so different. So if I have a family, I was just talking to a family earlier today. I really wanted them to be taking this product twice a day, but they're like, I can't do it twice a day. You got school. Sometimes I forget. Okay, what can we do? What's the best that I can do for this situation? Not everybody can get an A+, but I'll take a B+ with effort, And so that's really why I like to, when someone says I try not to be too specific and look at the individual. Do treatments, take a look at things, obviously the importance of all the different types of therapies that we didn't talk about. So, I do case management a lot of the times. Weirdly, sometimes when parents are separated or not on the same page, I end up playing social worker to try to come to an agreement with them. So, part of that's what I kind of refer to as the art of medicine as opposed to the science of medicine. But, being able to assess that type of situation and come up with a plan that will work for this child, for this family, which can be so different. And that's kind of the most fun and exciting thing of what I do, because it keeps things really exciting and interesting.
Thank you, Dr. Berger. I know you alluded to in your introduction that you have a health education company. So we're going to make sure to share the website, the YouTube channel, your social media platforms. I think you have a podcast now as well.
Yeah, we're doing. Yeah, we want to make it out there also within the company, because while I can see patients in Florida, you can even do telehealth to start the doctor-patient relationship, with the caveat being as long as a hands-on exam doesn't compromise your ability to do the assessment. So I tell somebody, if you have a Bluetooth stethoscope, I can do an asthma evaluation, but otherwise you need to come in for that. But obviously when you're dealing with the types of stuff we're talking about, this is really more about education, arranging for tests, or telling people what kind of tests that they can get with their primary. So I do a lot. I do also offer for people out in the state the ability to do that. But it also, as part of Dr. David, MD, I do national and international educational consultations. So we sign clear documents that I'm not serving as their doctor, because if I'm not licensed where they're at, that would be illegal. I'm really, really clear that I would never do that. But still, I can help them out. Tell them, like, sometimes there are tests where people can order themselves now. That's a lot easier to do than it used to be. Or their primary care doctor can do that. I can't write a prescription for them, but I can certainly provide information. This is the dosing that I would consider using. See if you could have your local doctor do it. I'm happy to talk to your doctor. So again, I want to make myself available so I can just help people. I have this. I'm a very altruistic person, and I have this like feeling in my mind that if just everybody would listen, I really think I could help the health of everybody in this world. And it's like so interesting because a lot of the things that we had been doing for so long in terms of immune health, which we, of course, all of our patients were doing during COVID, and even during COVID, the number of people who are getting sick or hospitalized, nobody in our practice died at all. We see adults, not just kids. And so and then all of a sudden you started hearing about things like vitamin D and zinc and lowering inflammation. So all of the stuff that that I've been promoting for all these years kind of became more mainstream in the past several years because of COVID and no one knowing what else to do. So, that's kind of really why I'm trying to focus why, I actually presented to the FDA when they were doing the authorization meetings for the vaccines in the first place and saying, hey, you need to be transparent. There's going to be hesitancy. This is something new. A lot of people have concerns about something that hasn't been fully studied the way that most vaccines are. If you're not transparent, you're going to lose people. Let's face it, that's what happened, so I was really there trying to guide them, like, let me help you, contact me. I talk about these things in transparency all the time, so it kind of became after that a lot of the media kind of like, oh, here's somebody who's like actually saying sense that makes sense to people. And all of a sudden, like all these media people started calling me and getting me on and all stuff. And so kind of how things kind of exploded in the last several years.
So kind of a snowball to get to today with the education company. Yeah. So I did want to say for all of those who are watching, if you do have questions or comments, please leave them in the comment section below. Even if you're watching this after we've gone off the air, we can always, forward your questions over to Dr. Berger. Although I know, Dr. Berger, you also do live Q&As. I think it's once a month. So
once a month, and so it's a YouTube live thing. Anybody can ask questions. You could submit them ahead of time. You can submit them during that. I won't answer specific questions. So if you say to me, how do I treat my vitamin D level of 39? I won't get that specific. So I'll generalize your question to something like that. And that's so much fun because, again, I'm being hit up with like different clinical scenarios and, not preparing and kind of just to get to go at it. And that's a lot of fun also.
Yeah. So there's, please don't hesitate to ask your question. And if we, if one of your comments, if that sparks an idea for a new episode in the future, we will make sure to give you credit on air for coming up with the idea.
Sure thing.
So let me just check to see if we have any questions. I know Angel had a question, not more for Denise, but we'll get back to you. We'll reply back to you in the comments, Angel. And then we have a comment here from Amy, thanking you for this very important conversation. Thank you, Amy. And also from Maria, who is, I guess, going to be seeing you soon, Dr. Berger.
Wonderful. So you got the preview.
Yeah. So we're almost to the end of the show, but I didn't want us to leave without once again thanking Dr. Berger for bringing us this really important information, for being here this morning. Thank you. Thank you. I also wanted to remind our audience that we are back to our usual schedule of being on the air every other week. So our next episode is going to be on February 24th. So that brings us to the end of the show. But before we go, I want to ask you for a little favor. For all of the regular viewers, what I'm going to ask. If you could please go to the link that we're going to share in the comments section to do a quick evaluation, just a handful of questions to let us know if you find value in what we are doing. So please don't forget to give us a like, share this video on your page, and meet us here every other Friday or at 10:45-ish, depending when we're done with Cafecito, so we can share a cup of coffee with you as we spill the beans on important topics related to autism. Until then, we wish you good vibes and hot coffee. Bye, everyone. Thank you.
Everybody.